Oops.
I did the video, but I didn't do the mute. Hi, Lynn. Try that again.
Hi. Hello.
Hey, Lynn.
We are Yeah. Hi.
Hi.
We're already recording. It just automatically starts recording when I log in. So I was gonna put in the chat. I was gonna put a note to everyone. So I have to remember the words. It's I want to make sure that people understand the chat is also a public document, because this morning at our board meeting, I got a number of private chats from members of the audience. So I just want to make sure people know that whatever they put there is part of the public record.
It's part of the game, huh?
And they can do that as long as they know it's, it doesn't hurt me to answer a chat, but I just want everybody to keep it appropriate. So how are you both?
Good.
Doing well. How are you?
The other thing that's good to do is, if you can, I learned this one, encourage people in that chat to change their screen name so people know who they are.
Right. So, I think our instructions said that.
Okay, good.
But I don't know if people saw the instructions. So that's something I should, let's see. This is, I have a very interested cat. This is a public meeting. And
hello, everyone.
Hello. Hi, Chandra.
Hi, how are you today?
Doing well.
Good. So you're going to be Jomo today?
Yes, that's usually how I go.
Okay.
The last name is kind of long.
We should all change them and be like Elmo, Esmo. Everybody be like, who are all these people?
All of them.
So hey, Chandra, do you have a second that you could, are you free right now?
Yes.
Because I'm trying to put some things into the chat box for everyone. If you could tell Joe about this morning's approach and how it went, just so he knows. He can choose a different approach, but I just thought he might be interested in what we did today.
Okay, sure. Have you told him anything? I don't want to repeat. Okay. So this morning, we muted all of the participants upon arrival, with the exception of the board members. And there were some board members that chose to mute, which was fine. And the way that they were recognized was that they raised their hands instead of just jumping in. And so I watched the chat box, and then we'll tell you, because I leave my microphone off the entire time. And then we'll actually let you know that this person is wanting to be recognized. And when there is a particular question for a particular organization, then we will ask them directly to come on and respond to the question, versus us trying to get all of the questions. They can actually answer direct questions from board members.
Okay.
I only will recognize anything in the crowd if it is directed to the conversation, and it will be only after the discussion with the board members.
Okay, sounds good.
And so that's how I did it this morning. And because of the share screen option, we'll just ask everyone if they have access to their agenda, and so that we can make sure that we can see everyone instead of having the screen being shared.
Okay.
And I'll also remind people how to raise their hand. If you go to the participants and click on participants, where it says invite, mute me, raise hand, that is how you raise your hand. And then you lower your hand that way. And that is how we will recognize people. But also there were some people who didn't know how to raise their hand. So I just kind of looked periodically. If I saw someone raising their hand, I would recognize them. Also, Lynn, we don't want to forget to add the names of the people and the phone numbers so that we can make sure that.
So Lisa mentioned that, and that is actually in the instructions, which apparently no one read. So I'll put that in here.
Okay.
Because I think, so right now, I think we've got some first names, but mostly names. So I'll add that. I'm right now adding what you're saying about the raised hands, because that worked really well this morning.
Okay. And then as you have on here, and I did send like another reminder when more people came in because you were talking. I just chatted to everyone to remind them to make sure that they signed in to the chat box and said who they were from, because it's our official record.
Yep. Thank you. That was very helpful. The chat document, which is produced with this recording, is actually very hard to read. It's just an old-fashioned text document. It's really hard to read, but the information's in there. So it does serve like an attendance sheet. It's a good thing.
Okay.
So.
But I'm following along with the agenda. So I'm paying attention to the agenda. I'm also paying attention to who has their hand raised and who doesn't have their hand raised. Lynn is still having control as the host. So she will remain host unless she just needs to pass it on to me, but that won't be anything during the meeting that we will disrupt the meeting for.
Okay, sounds good. Thank you. It's my second meeting today, and I am not looking forward to it. I mean, I'm tired of looking at the screen all day.
No. Well, hopefully we'll be able to just go through things smoothly.
I hope so too. I hope it runs.
And also the way that they went through all of the program summaries is they did it by priority.
Okay.
And so, and the way that she asked
Chandra,
was,
wait. We have, but Chandra, wait. These program summaries are organized by reviewer, not by priority. So they can't do that. Yeah.
Okay,
It would require quite a bit of time to reorganize them by priority.
Okay, well then we will just do it the way that is listed in this, book.
It is roughly alphabetical. It's alphabetical by initials, which isn't exactly correct, but it's very close. So.
Okay. So strike that comment from the record, what I said.
So another thing, Chandra, for you probably saw it, and for anybody else coming in, there is a link early on in the chat to the full board packet, but Chandra actually can share the agenda on the screen, and then as we go through the board packet, if you want to, she would also, are you still able to do that, Chandra? I'm speaking for you, sorry. Okay, all right, so, and she has the documents separately so that it will be easy to go back to the agenda if you want to.
So yeah, and the only concern was that earlier when we had talked about doing it, it was trouble actually seeing she wanted to see everyone's faces. But it's really based on what you want, Joe. So I can show you an example of what it could look like. So that's the board packet
Yeah.
that I would share.
Mhm.
If it acts right. Yeah. And then I could scroll through.
Mhm. Okay.
So yeah. And then the agenda is here. But again, if people have their agendas and board packets in front of them on their own computer screens, then there's not a need to share my screen. But it's totally up to you.
Yeah. I mean, I would say sharing the screen takes a little bit away. If we can just have a conversation, that should be fine.
Okay.
I think if everybody's trying to share the screen, it might take a little bit of time because it's a little bit of, I think, at least from the last couple of meetings I've had, it gets a little bit jargony.
Okay. So I can stop the share completely and we can just do it that way.
Yeah.
And
Right,
as far as speaker view, if you want to have yourself as the speaker, then you would be on there while all of the other icons would be to the top of the screen. So for every person that's speaking. But I have it in the gallery view now so that I could see who wants their hands raised.
Each person can present it to themselves in a different way. The recording is being done in speaker view, but for some reason, Chandra, you're still on it, even though I'm speaking. I don't know.
But you're on my screen.
Okay, all right, so now I've got speaker view because Joe came up. Okay.
You don't have the whole gallery, or you don't want the whole gallery?
I could do that, but
you know, yellow around the speaker.
Yeah, I could do that. It depends on how many participants. Right now we're manageable. Okay. If we get too many people to show on one screen, I'll go back to speaker view because this is the document that will be available publicly.
Okay.
Yes, he peed in the potty. I changed it. Yeah, he was wet. But he went potty again.
Sebastian, what did I say? What did I say back then?
I actually don't like these Zoom meetings. I don't like that I get to see myself the way other people see me, and it's really a frightening sight.
Oh, come on.
You know,
man.
I'd
I
just
never
like to point
expected
out, Tom, you could do what Jane Sprandl has done. I think she wins the prize for the best background today.
that.
It's amazing.
Okay, but that is because I am actually in my master bathroom. So
Oh, yeah.
I could actually shut off my virtual background for a second. So I mean, it's pretty, but like if anyone walks in, then it's like Hey.
I've got one for you. See mine.
Well, that's nice.
Oh, that was great, Lynn.
Isn't that nice?
I like that one.
Those are a lot of fun. Okay, I'm gonna stop it. This is a very serious meeting. It's good to see everyone. Or a little box with your picture in it.
Mhm. So in other news, which is somewhat kind of like affiliated with this, NAMI is doing their family to family class on Zoom right now. So that's been
Cool.
kind of interesting as we go through that.
Are there any other, who are the other board meeting members that we're waiting for? Who are the
That's
other board
6.
members we're waiting for?
I think you
Julia?
Should we do
waiting.
roll call?
So once you start up, we can do roll call, and then Stephanie will tell you if there's a quorum or not.
I know that Kathleen Worth Couch is not going to be available tonight. She sent
Yes.
regrets earlier. Okay, you knew that. Well, there are 7 of you.
Okay. It's 5:46. Call to order. Stephanie, can you roll call, please?
Sure. Susan Fowler,
Here,
Tom Moore,
Here,
Joe Omo Asagie,
Yeah.
Elaine Palencia,
Here?
Kyle Patterson,
Here.
Julian Rappaport, Jane Sprandel,
Here.
Kathleen Worth Couch, John Paul Joachim,
Here.
we're good.
Okay. So we got the Zoom instructions already. So this is kind of really odd. So citizen input or public participation.
So
how
at this, yeah, so at this time, if you have any citizen input or public participation, please raise your hand and you'll be recognized. Doesn't look like anyone has anything, Joe.
Okay, no raised hands.
Nope.
So let's approval of agenda. Anyone see we have to approval of
I
agenda.
approve. Move.
Who's so moved? Who's going
I
to
will
second?
second.
Okay. Thank you. So comments. This is an odd time, and I read an article just a few days ago saying the next pandemic will be mental health, and it's something that we ought to be aware of. That's in this time that we're home, and we're all doing things a little differently. We have to take care of ourselves, our health, not just our physical health, but our mental health too. Anyone add anything else? That's me.
well, Joe, I would like to add to that. I had spoken to Lynn earlier about this because in some cases, people who have written about the earlier pandemic about 100 years ago, what their comments were is that these events change our society forever. And I think it's we as this
Hey, Tom.
Can't hear you, Tom.
I'm sorry, I accidentally muted Tom because it says Martha. And I
Got it.
was muting everybody but board members. Okay,
Oh,
sorry.
okay.
Sorry.
I was just saying
It's
that.
Tom, not Mar. I'm sorry.
Can you hear me now?
Yes, go ahead, please.
What I want to just add to what you were saying is that people have written about how these pandemics or epidemics, whichever case they may be, change the environment forever. And I think for mental health people, we need to be thinking as a board, what changes do we think that are going to come about as a result of this pandemic? And it's incumbent upon us to somehow get prepared for that. I mean, of course, it's a shot in the dark, but we shouldn't be caught without having given it some thought about what's going to follow when this is.
Yeah, definitely. Definitely. I mean, the 1918 flu epidemic changed the way buildings were built. And so we have to be aware that there are going to be changes. We might not see it immediately, but it will be something that is evolving and coming around.
Well, and I feel this is something that is affecting, all ages, all income levels, everything. I mean, I have a college student who's not sure what the fall brings. I have a freshman in high school who's devastated she's not in the classroom. I had to tell my grandmother that I'm not going to come visit you. And then finally the other day I said, I'll come visit, but there's rules. So it's every gender, every economic, it's everybody. And I think that's one of the first times in all, like you said, a very long time, we've encountered that.
Okay. So, Lynn, you have a comment for us, or anybody else have anything any board members have anything to add?
I was a few minutes late getting on to the Zoom, so I'm not exactly where you are in the agenda. Have you already looked through the responses of the agencies, or is this prior to that?
No, we're just doing comments right now.
Okay, thank you.
No problem.
We were doing president's comments, and Joe opened the floor to other board members. I will keep my comments really brief. Every day is an adventure. I'm trying to pay special attention to opportunities for economic relief for nonprofit organizations that we fund, economic relief for the people that they serve. There is a lot of talk about innovations in mental health care. There are new crisis lines and warm lines are being used much more frequently than before, but I do think Tom and Joe are right that we're going to be looking at new needs too, like different, not just different approaches, but also different conditions and all kinds of things. But just keeping track of the regulatory and legislative drama is really intense, and I think it's starting to be a real drain because I can actually sleep all night now, and that's different. I do want to make one comment to remind people there is information for all participants in the chat. Please don't use the chat for anything but to sign in. We're asking everybody except board members and staff to sign in with your name, and if you are representing an agency, to put your agency affiliation in there, and also to make sure that when you have joined, that whatever your nickname is in the participant bar tells us who you are. This is a public document. It's being recorded and it'll be posted as soon as possible. So while it's a new forum, this is still an open public meeting, and I want to just make sure everybody's prepared for this to be seen by the whole world tomorrow, because everybody reads our stuff. So anyway, there is a lot of business. We chose to put the impact memo at the beginning of your board packet, even though there's a great deal of important business for you after the impact memo. In my conversations and communications with various board members, I got the sense that what's on your minds really is about what's going on right now and what we're going to need to do to respond to it and to support our community, and especially mental health needs. So we asked for input from all of the agencies that are funded by both the Mental Health Board and the DD Board, and they were very gracious and gave us a lot of good detail in a really short turnaround time. So I thought this would be a good way for you to start the meeting, and hopefully it's in support of any discussion that you feel like having about positioning ourselves. But then after that, there really is a lot of important business for you to look at. So I don't want to wear you out either. So that's what I've got.
Thank you. So ready for the new business now?
Well, I would just like to comment that I think the responses from the agencies were amazing.
Yeah.
I was deeply impressed by their and this is a bit earlier than now. So I think it's very informative, and I'm quite encouraged to see the way so many of the agencies that, or the programs that we have business with are adapting to this. I'm impressed by our local community's mental health program responses to this particular situation. So I'm quite encouraged by that.
I agree with Julian, and it's clearer that the phone and computer connections through Zoom or Skype or whatever are really essential for staying connected between the agencies and their clients. And they seem to be doing it very well.
And part of the difficulty is that there are still segments of a population that do not have the internet connectivity in the rural areas or even in some parts of Champaign Urbana too. They have cell phones, but sometimes it's not enough. So as we look to new business, anybody else before we move to new business? So do you have any comments about the agency responses in new business and about COVID-19?
Is it okay for me to make a comment here, Joe?
Yes, go ahead, please.
Okay, I know this is a board discussion. I do want to suggest, since the agencies gave us so much information about where they, and Julian is right, this is where they were 2 weeks ago, or a week and a half ago when we asked for the info. So things may have changed quite a bit. I think that it's helpful as we go through the program summaries and discussion of applications, if you're ready to do that, to know that we already have some processes in place in the contracts in the typical contract that we use, and we can even lift that up a little bit more to allow for some flexibility in the coming years. So if you like what a program is offering, but you're not sure how they're really going to do it, like because it's place-based services and requires an in-person contact, I want to make sure that we have the flexibility to address those kind of questions during the contract year too. So just, it's hard to look at things that people wrote back in January and think it was only January and things are so different already. But we do have the ability to work with the agencies on the changing service situation. So.
Okay, thank you.
Lynn, have you had any agencies that really aren't making it through this? Is everybody able to adapt and keep going?
They have in the responses, you can see that some are really not able to do a lot. If direct service is the service, it's really hard to do that now. So, and I think, like with some direct service, which is essential for people's survival, there's staff are moving in with the people that they serve. So that's one way that happens. But for the most part, these services are continuing because people can do a lot of the work virtually, but not everything. And what struck me is that case managers are especially important right now because there are new programs that may be helpful to the clients that they serve and maybe even to the agencies themselves. So people who have those case management type skills are really important right now for all of us. I want a case manager myself. So we haven't seen anybody completely leave, you know, completely out of business, but it is really very hard to see how some of these services will survive. So.
Yeah, thanks.
Yeah, thank you. So, do you have any comments?
I just want to thank the staff for putting this list together. This memo is really comprehensive, and for the agencies who responded so promptly. I know that for me, and I'd spoken to Lynn, one of my big concerns was, you know, our programs being able to continue to operate. All of them almost universally involve face-to-face interaction traditionally, and it's really amazing to see how agencies have adapted to this. I'm very grateful that this didn't happen 20, 30 years ago. I think that there is going to be a huge mental health impact of this event. I mean, it's very apparent. And, you know, I'm hoping that as we sort of are forced to embrace information technology more, that this is going to lead to a better result in, you know, being able to utilize and integrate technology into the services that are provided. You know, I'm hopeful that, you know, even something like telemedicine would even, you know, make an individual that might be hesitant otherwise more likely to try it out and, you know, get the help that they need. So just really thank you to the staff for putting this together.
Yeah, very much so. Sheltering in place when you don't have much of a place is really difficult. And our agencies are doing their best to help shelter those who don't have places to shelter in. Any specific comments about any of the programs right now?
I have a question.
Go ahead.
Maybe it's what Lynn was referring to when she was asking for the freedom to deal with contract changes over time. I'm going to guess, hopefully I'm wrong, or else it's not as bad as it could be, that we might see a drop in the numbers of people that can be served for various reasons, some of which you're referring to, Joe.
Yeah.
But I'm not exactly sure how we can be helpful about that. I think most of the settings are going to have to figure out themselves how to best reach that. But in some way, I don't know, maybe it would be useful for the mental health board to host some sort of, once people have had a chance to really assess what this looks like in terms of the people they're serving and the problems they're having, to host some sort of group conversation so people can maybe share ideas with one another. Maybe it's probably happening already informally, but it just occurs to me that perhaps hosting some kind of community conversation, I mean by community, representatives from the various agencies that we're funding, and have them talking with one another and raising issues. And maybe we could be helpful in some way. I don't know exactly what way.
Yeah. I think it's an ongoing conversation to have, and we have to be cognizant of the stresses that many of the agencies and the individuals in the agencies are facing, because it's not just about you and your family, but also the community at large is dealing with this stress itself.
Would it be okay for me to respond? I don't have the raise hand option because I'm the host, but I just wanted to add, I think it's putting together that kind of a forum or a community conversation, you know, there's a little bit upfront to make sure that you're doing it in a way that lots of people can participate, but I do think that would be a great thing for us to do. Part of what you're looking for happens each month when the Mental Health and DD Agencies Council meeting occurs, and that's it's always the Tuesday after your board meeting, but that's a piece of that. So maybe we could talk to them about how to organize a larger forum to accomplish what you suggested.
Sounds fine to me.
I mean, just to get that started, I guess.
Yeah. So if there are no comments about the impact of COVID beyond what we've already said, we can now move to the application review process. Is there any comments before we go?
I would just like for us to kind of review the ground rules for how much time we spend talking about the proposal, and so that we can get through as much as possible in this next 2 hours or whatever our time span is. In the past, we tried to keep our comments to under 5 minutes. Between the primary and the secondary reviewer, and to focus on questions we have for the agencies rather than just reiterating what the proposal already states. So that would be my input.
I think that's fair, because that's at least the last couple of years that I've been involved, that's what we've done. And yes, this is a different format, and you've just got to be hopefully cognizant of the time that you're speaking in. So,
yeah,
because we don't have a timekeeper, do we? So
yeah,
I could probably do that. It's
okay.
I like taking notes when you're talking, but and I sometimes forget to check the timer.
I can take time, Lynn.
Okay.
Can you do that? Okay, thank you.
So do you want it to be, because when we did this before, they didn't want the time. So do you want to adhere to the time, Joe?
Yeah.
Want to do 5 to 7 minutes,
yeah,
or
5 to 7 is 7 would be the top.
Okay, so I will set the timer for 12 minutes. I mean 7 minutes, not 12 minutes.
12 is too much.
Okay.
I want to be here till tomorrow.
Okay.
You're talking about both reviewers?
Yes, both reviewers.
Okay. Well, Lynn could always mute us when we get to that point.
Go for it.
Lynn, how does it feel to have a mute button on Julian?
I was inviting it.
Power.
That's too much power for me.
Embrace it.
So just for clarification, Joe, 7 minutes per summary, or 7 minutes per reviewer?
No, it's not I mean, for the whole thing, and we don't want to keep going over the points. We will say, if there are any questions that we have about each program, I would like that to be the most important aspect of the presentation.
Okay.
I like it. This is what I would like to know more about.
Okay. Mm-hmm. And so for board members, I'm paying attention to the time, but also I'm looking at I have my phone off mute. And if you want to be recognized or you don't see, I'll make sure that I'm looking at the chat box. But also for organizations, you are able to answer their question immediately. So if they are reviewing your particular program, I would encourage you to just be ready for questions.
Okay. So first up is Julian Rappaport, and with Kyle Patterson as the secondary reviewer.
There I go. Stop taking up my time.
Congratulations.
Okay, well, this is a pretty straightforward one. We started this last year, I believe it was the first year. And what it is a person basically to coordinate the efforts to deal with homelessness in our community. And there's some 27 agencies now involved. If the responsibilities are fairly straightforward, they're to keep people up to date with the federal guidelines and the approach that we're using and to coordinate. I don't know whether or not the agencies that are now participating are really happy with the way it's working or not, but I'm presuming that they are. I have no reason to think they're not. So if they are, it seems to me this is doing pretty much what we expected it to do, and they're not asking for any more money. So that's kind of where I'm at with thinking about this. I would be interested at some point in knowing whether the agencies who are a part of it are finding it helpful to them, but I don't need to know that right this minute. That's it.
Kyle?
Julian bopped a lot of it on the head, but I guess to answer his one question, I am somebody who in my day job, I do attend these meetings, and I'm happy that there is somebody in this role who can help to coordinate with the different agencies, and I get a lot of really good emails from Thomas at work, so it seems like pretty good.
Okay. Thank you. Any questions for the organization itself?
Susan has her hand raised, Joe.
Go ahead, Susan.
So I just had one question, and that is, do we have any data collected on the number of homeless individuals who were placed in this past year in community housing, or on what the status of the wait lists are with the cooperating agencies?
Okay, so Lisa Benson should be able to talk about that, or someone from that program, if they are available. You can unmute yourself and let them know that answer.
We do have that data and we can share it. I believe, Susan, you specifically asked if there was data regarding the number of individuals that had been placed into housing. And the second question was, you're gonna have to, I apologize. You
wait list.
Wait list. And we do. We actually specifically provide information about wait lists at every continuum of care meeting. And we can run specific data regarding individuals that have moved from homelessness to permanent housing.
Great, thank you.
I don't see any other hands raised.
Nope, there are no other hands raised.
Any questions or comments anymore? Okay. We can go to the next one. We are not making any, we just presented right now.
Okay, so I think that is mine, the Champaign County Christian Health Center for their mental health care at CCMHB. This one, they're actually asking for a significant increase. It's actually an increase of 153.8%, which seems kind of crazy, but it's actually $20,000. So don't let the percentage scare you. We have recently heard from this program, and like many of our program folks, they're struggling getting trained providers. So they're looking for some assistance to help kind of do some recruiting on that, things like that. You know, of course, it's no surprise to anyone that the people who are most directly impacted are the underrepresented minority population and such. I was very happy to see that, you know, within 5 days of referral, they are getting assessed. So they're doing what they can even with limited staff. So that was impressive to me. So I guess I had a clarification question. We can come back to it. So they're trying to recruit another psychiatrist and I think a psychologist. So these are just part-time positions, I assume. And so it would just be someone who's working an extra day or two a week or whatever, I assume. So we can get back to that. What other questions do I have? I guess I don't know, it looks like they did not really have any success with recruitment last year, and I think that's what the original proposal for last year was for recruitment. And is that just because they didn't have enough oomph behind it financially, or is that potentially because it's hard to get those folks in the field? So Kathleen is actually the second reviewer on this, so I'm comfortable opening it up to others if they have thoughts or maybe answers to a few of my questions.
Is anyone here from Christian Health Center? Okay.
Part of the difficulty.
Mark, I'm blocked out, but I can speak since nobody else is, since Jeff Trask or Crystal don't appear to be on the meeting this evening. I can answer some of what Jane has asked about. I do believe they have had some success in recruiting a psychologist and a social worker to volunteer at the Christian Health Center. The gap that they continue to have is with a psychiatrist. And that is what their part of the increase request is to support is to pay, I think, $10,000 towards the cost of having a psychiatrist come in. So they have had some success in recruiting additional volunteers, but they still would like to recruit a psychiatrist and feel that they need to compensate that person. Thank you.
And Susan has her hand raised.
Okay, go ahead, Susan.
Yeah, my question, and it's a general one that can't be answered tonight, but I understand that the center is open a couple of evenings a week at OSF, which of course right now is a problem. But I also wondered, does this center or this service fill gaps from Promise Healthcare Wellness or from the Champaign County Healthcare consumers? Because they also are providing similar care. So I have questions about the extent to which there's strong coordination between those three agencies, and just clarifying that what the Champaign County Christian Health Center proposes to do fills a needed gap that can't be filled by Promise Healthcare Wellness or the county healthcare consumers. I can send that as a written question if you want.
I'll speak to that in some ways, because I mean at Parkland we do have we're trying to get our students out into the community so that we're not doing all the counseling on site, and some students ask directly for a Christian counselor. So this is one of the places that we sometimes look to fill that gap. And psychiatry in this community has been an issue ever since I've worked in the field for over 30 years now. We've not been able to get enough psychiatrists in this community. I can't remember since when. Mark?
I was making a notes. Were you kicking that back to me, Joe?
Oh, okay. Because you popped up on my screen. I was just saying, oh, something.
Is there
that might be
an
because I'm
electronic way to
making
raise
notes.
my
and
hand?
it's
Yes,
facing the
so
table.
Julian,
Julian's raising his hand.
Okay,
yes,
Is there an electronic way to do it, or am I?
there
Yes.
is.
Visual.
So if you go on the chat box where it's under the participants and it says mute me, invite, or raise hand, and that's where you raise your hand.
Really, if you can't figure it out, just raise your hand and we'll see you.
Well, I see.
So-
Okay, I see mute me, but I don't see something about raise. Oh, there it is, way at the bottom. I got it. Sorry. Thank you.
That's okay. Mm-hmm.
But your hand was raised, so.
So you can be recognized now.
Recognized.
Thank you. I just wanted to get something clear about this. My understanding about this organization is that all the staff, other than the executive director, possibly some very small amount of money for Jeff Trask, who was the founder, are and continues to consult and so on. That my understanding was all the ACT staff are actually all volunteers.
Yeah.
The providers are voluntary. So is this now a request to actually pay for a psychiatrist, or is it an attempt to get just to boost the salary of the executive director so that she has more time to engage in recruitment processes of providers? I'm not sure which it is. It would change the nature of the organization, I think, if they start paying staff. So maybe I misunderstood that. Does anybody know?
I don't.
Is that something, Mark, Mark has his hand up.
Okay, Mark, you can be recognized.
It is, Julian. Their proposal is to increase compensation for the executive director, and then also to compensate the psychiatrist. So based on your past experience with the organization or what you were just speaking to, apparently this would be a shift for them from having volunteers provide services to actually having to compensate the psychiatrist. And I think, so it's, anything else I would share on that would be speculation, but that is based on what they have in their budget.
Okay, Jane has her hand raised, Joe.
Jane?
I forgot to add in, they do currently have a budget surplus of $67,010. So is there a way we can question like where the surplus came from? Because we obviously gave them probably some money last year that didn't get probably used.
This is Mark again.
No, go ahead, Mark.
We did get a response from Jeff Trask. He is their financial person. And he questioned the amount of the surplus that they may have on hand, and would like the opportunity to correct that during the contracting phase. I did point out to him that last year, and it's what's reflected in their budget that's on file with us for the current contract year, is that for 20, the current year we're in now, they have a surplus of $45,000. He just was surprised at how large the surplus was that was reflected in the financials for the 21 application. So they may have a surplus, but he doesn't believe it's as large as what's reflected in the budget, which means they have an error in the budget and would have to be corrected.
Thank you.
So Joe, your 7 minutes is
Okay,
up in that for this application.
let's go for the next one. Thanks.
Mhm.
The next one is Head Start and Early Childhood. And Susan had a lot of questions. And John.
So I have the Early Childhood Mental Health Services. So basically, what the Champaign County Head Start is asking for is $209,906 to hire 4 social skills and prevention coaches. Basically, what they do, or what they will do, is they will screen children in Head Start with an ages and stages questionnaire, and also assess them in the school setting to see if they have behavioral issues that are interfering with learning, and then assess and make a plan that will make them successful in learning and in their education. And so basically it seems kind of strange that the state isn't providing the funding for this. We are the sole funding for these social skill prevention coaches. Basically, it seems like they're developmental specialists and behavioral specialists for the Head Start. It's surprising, but yeah, we are the sole funding for this. It looks like they're increasing it from the amount of social skill prevention coaches that they have from 3 to 4. They serve Champaign, Urbana, Savoy, and Rantoul. So they serve multiple areas of Champaign County. I mean, it seems like a very great program. I don't have any issues with it. It seems very evidence-based as well with the ages and stages questionnaire. These professionals have bachelor's degrees in like psychology, behavioral health, and sociology. So it seems very appropriate. The one thing in the packet was that a discrepancy of $1.2 million surplus that they have. I don't know if that is like grant money that's allocated for certain things that can't be used for those positions. So that it would be nice to have that clarification, since if they have a surplus, if that can be used for these social skill prevention coaches, or if that money can't be used for that.
So is someone here that can answer that question about the surplus? Okay, Lise.
Thank you for letting me raise my hand. Usually I can figure out how to do it before. So I talked with Brandy Grants, who's our director, and who took care of all the budget aspect of that, where I take care of the narrative aspect of that as the supervisor of the coaches. She's not sure how the numbers that you guys received were entered, because they weren't the ones that she submitted, but there is no surplus. So that's an inaccuracy that she's gonna make a change to and give you. I wish there was, but there is no surplus.
Thank you.
So I was the second reviewer on this, and I think John did a great job. I think, we have seen time and time again, the earlier we help these individuals, we can maybe change their path. And so I think this is a very important program. I liked, the idea and the concept of depending on the family's needs, the services are provided in classrooms, homes, or community settings. Best practice is meeting where the families are. There's so many things that you have to go to where the family is versus asking them to come to a classroom, come to the school. There's work, there's car issues. So I think that's good that they're really realizing we sometimes have to go give the service where it's going to be most comfortable and beneficial for the family. Other than that, it's a reputable program. I felt like it was something that, we should continue to support.
And I agree, with Jane. And, I would add that, one of the most important factors in a person's life to determine whether or not they'll be successful in life is their reading level in the 3rd grade. And if in, preschool and Head Start, if they are unable to focus and, be successful in school at that level, it's going to make them, just fall behind and make it harder for them to, be at the reading level they should be in the 3rd grade. And so, small changes early on, cause huge ripples in the future. And so this is, in my opinion, just a small investment that's going to pay back a lot in dividends in the future. And I just think it's a great investment. I wish there was other sources of funding so that, it could sustain more of any kind of future issues that may arise, in funding in the future, just because, it's better to have not all your eggs in one basket, just, but I'm glad that we're able to provide that funding for this. So.
Okay, Elise, I will come back to you after Susan's question, and then we'll come to you.
All right.
Susan?
Just wanted to make a comment that last year they requested, I think, 4 specialists, and I think left with 3 this year without increasing there are 4 specialists. That is impressive. But I would like at some point, and it may be next week, to talk about what the potential overlap is between this ongoing proposal, the Early Childhood Mental Health Services, and number 23, which is Social Emotional Services, which is a new proposal. And I just would like to understand the interface and funds. So I have no objection to the importance of this, but became a bit confused as I looked at the other Champaign County Head Start program, which is last on the list.
Okay, Elise.
So if appropriate, I can respond to both of those. Susan's question, is that okay?
Yeah.
Okay. So first, John, your comment about the funding and wishing that there was more than one option. For that, we do as well, and we're constantly looking for other sources of funding to supplement the work. We serve all of Champaign County, so we have about 600 children that we serve at 5 different sites, plus home base, plus family child care centers, and teen moms, so in a variety of settings. So there's me and these 3 other staff people for all of that, and that's not quite enough. We do what we can, but there will always be more that can be done. So Brandy applies to a lot of grants and is always in search of that. So that is something that we prioritize. Susan, your question about the difference between the specialists and this role. So these coaches have bachelor's degrees in like psychology, social sciences, human development, things like that, but they're not mental health professionals. The specialists as in like they don't have a clinical training. My role, I'm the specialist. I have a master's degree in counseling and a doctorate in counselor education, and I'm their supervisor. And that other role had been previously funded by the DD board, and my assumption is that and partially funded by the mental health board. So either the language has changed a little bit, but those 2 roles interact very strongly. I supervise those 3 staff members. We work together. My role is slightly different and more global, but it's very much related. Lynn might be able to speak more to that.
Okay, Lynn.
I would just like to make a comment. The program that supports Elise's position has been around for about 12, 13 years. It was funded by the DD board, and then sometimes it's funded by the mental health board with DD dollars. Sometimes it's funded by both, but it's always been identified as a DD program. And I think that's something we'll want to talk about next week, because it doesn't look like it's a DD program anymore. I mean, it's an important program, but so I think that's an issue that we might want to address with you. But to me, that's always been a clear difference. Like, you're under that contract, and then the staff that you supervise are under this new contract.
Correct. Yeah,
okay.
That's true. Yeah. My role plays I do a lot of like the child find stuff. So my role as a clinician, I do a lot of referrals for developmental disability issues. So developmental pediatrician, the school district, OT, and there's a lot of overlap between behavioral issues at this age and disability. And there's not a lot of funding for social emotional delays. The school district won't create IEPs for that specifically. The early intervention doesn't have a social emotional specialist in the county currently, right? So there's kind of a lack of that kind of support. So we end up doing a lot of that. But at this age, there's not a lot of diagnosis because they're so young.
And I'm aware of that, and that's the rationale that I've provided to the boards for many years, but it doesn't look like it's totally DD dollars. And so I think probably we should talk about that next week when they're looking at that application. But I just wanted to clarify that you are paid for by that contract, your staff are paid for by this contract.
Yep.
Even though your role is described in this application proposal in much more detail than their roles are. So
Joe, just wanted to let you know your time is up for that one. But if you want to continue, you can.
I mean, yeah. Let's continue. Let's go. Let's move on. Thank you. Next one.
Okay, I think that's mine. The Champaign County Healthcare Consumers Community Health Worker Outreach and Benefit Enrollment Program. That I think this is the second year we're funding that directly. It was subcontracted through Rosecrans, is that correct? They are asking for a 31% increase from 59,300 to 77,960, and there's a clear explanation as to what that increase entails. There was some underestimation of costs from last year. It's kind of across the board. Most of that money we'd be giving for staff. The health insurance has gone up and so on. They are that unique piece in the mental health, substance abuse world of connecting people who need services with the services. And we just, of course, saw a presentation by them recently and asked a lot of our questions then about how they, in doing their job to reach out and find the people that need their services, find people at different places in town and offer services at different places. And so this whole pandemic is going to be very hard on that kind of thing and those warm referrals. But they also, in our packet today, had a detailed explanation of how they're adapting. So they're right on this. And while there are other agencies in town that can help people find services, that enroll Medicaid, and now Lynn sent us just this week, I believe, a memo from them about how they're now going to be helping people with getting their stimulus checks and that kinds of thing. So when they presented to us, we learned about all the other issues that come up with the population they're helping, like homelessness, like literacy, like getting SNAP benefits and all of that. So their staff is certified, unlike many agencies who have people who might help with getting benefits and getting enrollments. Their staff is certified in this area, and that's very important. I mean, I think they're providing a crucial piece. There are two of these. We'll get to the next one about the people involved in the justice, criminal justice system, who they also help. So I didn't, they do get other local grants from Carl, from OSF, from places like that. Relatively small bits of that money comes to this program, but that's, something they've done with their own budget that I don't particularly, understand how it's divided up. And our staff has shown that they ended up with a surplus that doesn't match the amount on the next application, the justice application. So I don't know if that will have to be explored if it hasn't already been, that little difference there. Is that something we have an explanation for at all?
I'm not sure if there's anyone here present from Healthcare Consumers. I do not see anyone, or if Mark could answer that question.
I'm not in a position to answer the question on the surplus. That was a different team member that raised that.
Okay.
In terms of the program, in looking at the program summary, the program shows a surplus of $11. The agency shows a surplus of $41,000.
Yeah.
I'm not sure why there's a difference between what the surplus amount would be on the they're essentially the same. It's a difference of $1 as I flip through. So I think we would have to ask the agency for an explanation.
Yeah, I assume that you'd be going into that. I just, it's one of those agencies that kind of is glue that holds a lot of other things together. And they also have a very good cultural competency program that they submitted. So I feel like they are kind of hitting all the right requirements for inclusivity and serving marginalized populations and so on. Here's my second on this.
I think Susan has that one.
Oh yeah, Susan,
Yeah,
you have some questions?
I'm the second reviewer, and I agree with Elaine that this program is really important in terms of its acting as glue. It links clients with no medical home to medical care, and so that's very essential. And hopefully they then have an established medical home, whether it's Promise, Carl, or OSF. And the one question I have is that when the Champaign County Healthcare Consumers refer clients to agencies like Promise Healthcare or Carl Community Care for assistance, do they continue to be involved with the healthcare consumers or with case management, or do they pretty much move over to the other agency for support? And does this then open new capacity for CCHCC to work with other families or with other clients? And I can send that question.
Joe, just to let you know, your time is up for that one, unless you want to continue.
Are there any other comments for this? I mean, that was a really good question to see if there's any follow-up from the healthcare consumers. But we can probably visit that next week also. Thank you. Who's next?
So the next one up is, I'm the first reviewer, and it's, well, these are related programs, so in that a lot of the activities look quite similar, except they're aimed at a different target group. They're aimed specifically in the justice-involved services, and benefits are aimed specifically at people who have involvement in the justice system. And quite a bit of the work goes on, or has been going on up until this moment, in the jail.
Yeah.
So the current situation, of course, presents unique problems. And they've done some very interesting and creative things to sort of try to cope with that through various phone contacts and directly and indirectly, and they had to make some adjustments. I'm not sure exactly where that's going to end up. But putting that aside for a moment, I think it appears to me, and I don't know exactly how this works, if you look at the current year funding was 54,000, the request for the increase this year would bring it to 75. The justification is that there was a mistake made last year in how much it actually cost them to do this, because when the program switched over from being funded through Rosecrans and simultaneous with the director having some health problems, what they're saying is that there was just a mistake made in the budget. And there's also been apparently increases in insurance. So I understand all that, and I think it makes perfect sense when I'm confining myself to talking about this program. It sounded like the same rationale occurs to the program that we just talked about.
Yes.
So are we raising the same? I'm not quite sure how that, is it a different increase for something different so that it's repeated? Or should there only, I didn't quite realize when I was reviewing it that the same increase was justified in the same way for the first proposal. Having said that, I followed this program for a long time in our community, and I think these are amazing people that do a heck of a lot with very little. So, and I think they've become quite integral in many ways, starting with just healthcare services and then moving more recently into the areas that we're concerned with. So I don't particularly want to say anything negative here. I just want to comprehend what's happening with those increases in both programs. I think maybe Mark understands that, or Lynn, or somebody other than me, so we don't actually have to ask about it, but I don't know how that's working. Otherwise, I think they do good work. I think that they justify what they do, and they do it well, and it needs to be done, and they're helping people who, with respect to this one, who often don't have a very easy time getting the kinds of supports and services that would be available to them if they didn't have help like this. So I think that's what I want to say. And there's a second reviewer, Elaine, right?
Yes, but I don't have anything to add to what I said about the other one. This goes right along, except to say that this program, the justice part of it, I believe, got an award for being an innovative program to concentrate on the jail in this way. And I think that's, worth noting. But that's all I have.
Eddie,
So do Mark or Lynn want to comment? I'm sorry. We're not out of time yet, are we? So
no,
Mark,
you have about 3 more minutes left.
Okay, I'll let Joe take it.
I'll say if you have any more comments, go ahead.
I just
Okay,
wondered if Mark or Lynn have some better understanding than I did of that budget issue that we just talked about.
Julian, this is Mark.
Yes.
I think you're right when you say that the justification for the increase is the same in both proposals. I'm sympathetic to the situation, but I also look at what the total budget was for last year as part of the analysis. And the total amount of funds that were committed to the program has actually gone down from last year to this year. So there were additional resources committed to the program that aren't either available or being committed this year. They have a contract, I don't know if it's new or not, but through Carl, they're getting some additional funds, and a very small portion of those funds are committed to both of these programs. And so there's a question there. The other I guess, observation I would make is that when they were with Rosecrans, the justice program operated for many years at about $50,000. And so we're in that range now. So anyway, I'm just laying out some of my observations as far as what changes have occurred with the budget from last year to this year. And but Claudia in her application did point out that at the time she did the application, she was ill last year, and some of the calculations weren't appropriate, weren't calculated properly. Last year, when we considered the justice application, we had the opportunity to either continue the program as a subcontract with Rosecrans or contract directly with healthcare consumers, and felt that it was better to contract with them directly. So now we have contracts with them directly, and now we're dealing with this question of an increase of 20 some odd $1,000 over what they received last year. So
okay.
I don't know that I'm answering the question. I'm just providing some observations, like I say.
It gives a good background to what we're talking about. Thanks.
You have no more questions, and the time is up for that particular one.
Okay. So the next one is Courage Connection, and I don't even know if I'm a primary or secondary reader.
Okay, for the Courage Connection, if you can see, they're asking for like $127,000, which is the same as that they asked for last year. And what might look confusing is that there was an expectation for hiring an employee that they didn't hire, so we reduced the request by about that much. So there's really no increase in what they're asking for from what they got last year. What Courage Connection does, from what I can tell here, is they work with victims of domestic abuse, children and families, and they're one of the few that is actually certified in the county to do this work, although there are other related programs, 4 or 5 of them, other related programs, and they coordinate their efforts with them. So far, what we can see is that what they're asking for, that money will go to personnel. Let's see, they have about 3.6 personnel, and we fund pretty much most of that. So they're looking for counselor salaries, some that are part-time, some are full-time. They're looking for therapist salaries, and they're looking for client advocate salaries. They, although they're in Champaign County, they work throughout a variety of counties surrounding us. And actually, I'm of the opinion that as this pandemic, and particularly having to be at home extends, this someone dealing with domestic problems is going to be pretty essential. I don't have much. I don't have any questions about them. I think this is certainly a very needed program now, and it's going to be even more needed in the near future. And I think $127,000 is a pretty good way to spend our money.
Yeah, I agree with that, and I think right now with what's going on with the pandemic and the shelter in place, I mean, my question keeps going back to how do the victims live with their perpetrators, and what do we do as a community if with this in place?
So Joe, we have representation from that organization, and so if they would like to answer, they can.
Thank you.
Sure. My name's Elizabeth Cook, and I am the CEO of Courage Connection. And can everybody hear me?
Oh yes, I was supposed to have a meeting that way.
Okay, great. Thank you. Thank you so much for recognizing the need that has been here for so long, and will, we believe, continue to grow through this pandemic and as we move to the other side of this. The points that you bring up are excellent. So one of the things that to that end that we've worked very, very hard to do going into this time and during this time is to make sure that we have been in communication with local news media. Probably only a couple of days go by in between the press releases that we send to Deb Pressey, just in case there's room in their space. We have had our court advocates speak on different news channels to let people know that we are 100% up and running, that that there are ways to achieve orders of protection even during this very, very challenging time. Our counselors, as well as our client advocates that these dollars go to, have just, I mean, they're phenomenal anyway. And I just can't even tell you. I know I put it in the update that I'm humbled and I'm honored to work with them. They huddled virtually when the first stay-at-home order came down, and did a literature review on best practices for teletherapy. And so they've been looking at all kinds of ways to make that therapy from a technological platform to help our clients be able to work with that. We've got 3 different formats. So really, like, all you need is a cell phone, and we can find a way to communicate with you. They've looked at how to make the sessions friendlier. The other thing that we've been doing, we do have some money from another grant that had been designated for marketing materials, and we decided last week to just go ahead and try to flood Champaign, Urbana, just using a mail list that we procured, and trying to look for residences that might fall into a category where they might not be able to hear from us on a regular basis. We're sending out about 30,000 postcards that are just very, very straightforward, just basically talking about, you know, we want Courage Connection to be ubiquitous with domestic violence services. So we don't need to send you a 10-panel brochure, right? We just need to say, if you need anything related to to feeling safe and healthy in your relationship, call us. So we've been doing that. I'm really interested. We're assembling the numbers from this month regarding the number of hours and clients that we have worked with on case management. I'm really interested in seeing that our client advocates are providing an even deeper level of case management. We have added daily wellness calls to all of our residential clients. So we're not just, social distancing and interacting to make sure that folks are present and accounted for, but it might take us sometimes 4 or 5 times to get a hold of a residential client because of a work schedule, but we're talking to them and doing everything we can to provide services for them. So we're, and we'll continue that with the media, and we also were able to, we've done a Spanish language version of the postcard, and we've been able to identify 2,800 Spanish speaking households. So that version of the postcard has gone out to them as well.
Thank you. So anyone with any other comments or questions?
If there are none, we're going to take about a 5-minute break right now so that people can refresh. And then when we come back, we'll be doing Cunningham Children. So.
Okay, sounds like a plan.
Thank you.
Okay.
Thank you.
Take 5, take a break.
The recording will continue.
Good to know.
It's still a public meeting.
It needs to be checked for. And there's bags in. We've gotten to talk to
Are y'all ready to get back to it, or a couple more minutes?
Yep.
Let's go.
Yeah.
Okay, so next up is Cunningham Children's Echo Housing and Employment, but Kyle had to leave, making Julian the primary secondary reviewer.
Yikes. You have to listen to me again.
You're getting
I
all
was
the good stuff.
relaxing, assuming that Kyle was going to tell you all the important stuff. Okay.
He has another meeting. He apologized, but had to go to another meeting. I'm sorry, I surprised you.
So, this is another housing and employment program, and it's concerned again with homelessness. This is from the Cunningham Children's Home staff, and as you'll all know, their experience has primarily been targeted for young people. But they also, of course, work with families and so on. And apparently this is not just for young people. It could be for people of adult age. I'm assuming, maybe incorrectly, that they get into this because by the time the kids age out of Cunningham programs, they have to enter the community and they have issues with employment and housing. So that would give them a kind of natural place to be doing this kind of work. I think last year was the first year that we funded this. And they're asking for a $10,000 increase. They requested 95 last year. We gave them, I think I have that correct. And at any rate, no, it's a $5,000 increase. Anyway, it's $101,000 is what they want. And so there's no issue, I don't think, about the increase per se. But they work with local landlords. They're well connected in the community. I'm sure they have lots of interweaving things that naturally support this kind of work. They do participate in that very first program that I talked about, the Homeless Service System Coordination. And one of the things that they emphasize is that they're paying particular attention to a collaborative relationship with the UP Center and try to provide supports for LGBTQ people who sometimes have difficulty in both employment and housing. And I believe I don't know if they've done it yet, but they're talking about trying to increase their reach into northern Champaign County. Their actual outcomes, they actually do report some here, which during the first 18 months of this program, if I'm reading this correctly, they had 30 people sign up for this, 18 of whom were discharged to permanent housing. Then they have a few other specifics that they're how long they stayed with the program and so on. But so I think they also do life skills training. That data is a little less clear to me, since it's not, I don't know if all the clients are really participating in that, or if they're just not assessing it for everybody. So what do I think? Let me see if I raised, we're the sole funder. I'm sorry, I was correct. The 19 award, the award for 19 was $90,000, and 21, the year they're applying for, would be the third year. So they're currently in the second year. What else do I need to point out? I think they're pretty good on the cultural and linguistic issues and on the underserved people. I mean, it's sort of naturally built into what they do and who they are. There's some questions about the budget that I believe the staff have, but I'll let them comment if they care to. I noticed the staff do say, and I probably should have mentioned it in some of the others, staff is thinking this would be an appropriate program for a 2-year contract, though I don't think that's what's at issue right now. They had been involved with the Alliance for Inclusion and Respect, but that's apparently no longer the case. I don't know why. They don't really comment on that. That's coming from a staff comment. So I don't know if I answered whatever questions anybody else may have, but I could do my best at it if I.
There is a representative from Cunningham Children's Home on the phone. I believe Pat Aggie is still here.
So I don't know if I have a specific question for them, but I was asking whether anybody else had a specific question for me.
Okay, Joe has his hand raised.
Yeah, I talked to Pat Aggie a few times about this program, and I know they're going to be making contact with Parkland College, and there's a SWIFT program. It's called I can't remember what the acronym stands for, but in the times that I worked with Cunningham, and I still have some interaction with Cunningham, we know that between the ages of 18 and 22, if our young, I still say our young people are not involved in something, they end up in a justice system, and we're trying to keep them out of the justice system, and this is one way to do that. Housing and employment, or some kind of career training. I know I am going to be meeting with the career counselor at Parkland tomorrow to talk about pretty much this program and see how Parkland's career counselors could work with the Cunningham youth also.
So let me just then end it with this comment, unless somebody else.
Pat Aggie wanted to remark on something, so.
Let me finish first.
Okay, yeah, you can finish, and then Pat will remark on anything.
The one thing that I just couldn't figure out was exactly their target population with respect to age. I know that I understand from the demographics that 93% of the people are ages 19 to 59, but I was imagining that most of those would be on the younger end, and maybe that's incorrect. So I wouldn't mind clarification of that as long as Pat's going to comment anyway. Okay. Unless I'll stop now.
Okay. Hey, Pat.
Got it?
Yeah.
Got it? Okay. Actually, Julian, that's exactly what I was going to comment on, is we've really developed over the last several years, probably 10 years, more of a vocational employment component. And that's anywhere from the youth that we've worked with DCFS, but we recently, as of last year, have now the state grant for the runaway and homeless youth. So we're beginning to put pieces together that are not only looking at the employment side, but the housing side. And so what I talked to Joe about is not only for this program, but for the runaway and homeless youth, let's get ahead of looking at what certificates and some other things that we can get ready during the COVID time, some things online, certifications, those kind of things. So this is the full spectrum. It added, we are able to handle all the way through the lifespan. Our vocational program also has some United Way funding. Now we have the runaway and homeless youth, WIOA. So we're really trying to build a more an infrastructure that's all the way through, and that is based on the work that we've done with youth from the foster care and independent living program with DCFS for years. But it's been building on that for the last 3 years. Hopefully that helps.
Yeah. Thanks.
Okay. Thanks.
Any other questions for Pat or about this program? or comments?
No hands are raised.
Okay. The next one is the parenting model and implementation from Cunningham Children's Home. I can't remember if I'm a primary reader or secondary.
Primary.
Primary.
Okay, good. I'll go ahead then. This is a program that serves youth 10 to 17, and it's try to create a situation with the Youth Assessment Center and with the different agencies around to get youth and their families involved in a system that provides services and provides counseling for them and for the youth involved. They're asking for a 43% increase, but I think because it's a new program, it's a relatively new program, we're just starting to, I keep saying we, Cunningham is just starting to have it implemented within the larger community. And it is, from what I see here, the numbers, we've had a few people, a few young men and women, or young men are probably involved so far, but it's still in its infancy. And with COVID now, it's kind of at a standstill. And I think Pat might have some more information about what is going on right now with COVID involved. But the anticipation for at least 75 clients would be, consumers would be a really huge number, and that would be great if that could happen. But I have no problems or questions about the utilization of the funds or what the services will be. I think looking at having master's level and bachelor's level involved in it makes it a little bit much more flexible in how services will be provided.
I'm the secondary reviewer on it, and I agree with Joe that I'm really pleased to see the development of this program. We had ended, or Rosecrans had ended Parenting with Love and Limits, and we were looking for an agency to come forward with another program that could meet the needs of youth 10 to 17 and their families who were just in danger of moving into the juvenile justice system or even farther. And they have put together, by collaborating with I think it's 18 agencies,
yeah.
They have memorandums of understanding with a large group. They put together an evidence-based program that's based on ARC, attachment regulation competency. They have identified good, strong staff qualifications, masters and bachelors. They have really clearly specified outcomes that they should be able to measure that will tell us whether or not the program is working as intended. The outcome measures rely on survey and assessment tools. They have a consultant, but the consultation is short-term, not long-term. It's they will be able to run the program independently without needing to pay for ongoing consultation once the program is established. So it's more cost efficient than the prior program that was struggling to attract families and youth. And if they're actually able to serve 75 clients, of which they hope to have 50 in their full-time program, which runs 7 months, and 25 in a short-term program, then that will be just a wonderful boon to the county. Yeah. So I was really impressed with the application and the progress.
I am impressed with it, and I see it moving forward.
Okay, we have about 3 more minutes left,
Pat,
so just to let you know that.
Add to it?
Okay.
Pat,
yes.
You have anything to add to this?
Yeah, thanks. You filled in a lot of pieces that I would have said in terms, both of you, in terms of we're trying to replace a program. We do currently have 5 clients. We have 2 full-time therapists. One just finished training yesterday. So to get the workforce has really been an issue, and that's been, we're very thankful we have that. And we also are hiring at that 1 bachelor's level. So we have a capacity of 5 as of today. And by the time the next therapist is in place next week, we'll have another 7. We haven't had a lot of referrals from the Youth Assessment Center. And that has to do with the fact that they're not coming through the doors there. And so we have a call into Julia Reitz, into Ramona. We'll be calling Mike Williams, and we, instead of starting at the front end, we may go to maybe some youth coming out of JDC. So we're prepared to handle across the spectrum. Probably the biggest thing that's going to make a difference is, as both of you recognized, is that this is a system of care approach. And so we would like to have the juvenile justice system be trained and trauma informed. And this is, we're already going to have a 2-day training next week with the folks from the Youth Assessment Center with our consultants. So we're beginning to bring the consultant into other people in the community working with the family. So we think that just makes it stronger. It's not just us working with the family and then a handoff. So we're really hoping, the consultant's been great. She's from Canada. And we're meeting with her every other week for 2 hours. So we're really getting a lot of opportunity to speak with her. The 2 and 1 day training for ARC is not going to happen because of COVID. So we will be using a lot of that towards training. And then as you've mentioned too, the goal is to, if after a 2 or 3 year period of time, we have to train the trainer on site. And that person has 20 years experience in our agency. So we have a lot of belief that this is going to be setting the tone for the future. And the final piece that I'd like to say, if we could get a juvenile justice council or mental health and juvenile justice council, that would give us a chance to look for other funding to support this. So it's not always going to be an ongoing, if we can put some other pieces together in our community that's more supportive for this population and families. So that would be it.
And the best part, it's local. It's all local. It's going to be either training or trainers are here, and the trainers are here, and yes, it's something to last because it's not an outside agency. Any questions or comments?
The next application, did you see any more hands up? I'm sorry.
Nope, there are no more hands up, so we can go to the next one.
So the next application, I think the primary reviewer is John Paul Joachim, who's still here. And this is the Don Moyer program for CUNC, which used to be the Neighborhood Champions, but it's evolved. So anyway, but there is a representative of that program here if you have questions for her.
So the CUNC is requesting $130,000, a 20% increase from last year. Basically, they are targeting areas of the community that are affected by violence, and specifically gun violence. And they are, it seems like they've worked really hard to be, connected with many aspects of the community. They're working with a lot of partners, and they provide, groups for families and and workshops for young adults and teens that are affected by this. And it seems the allocation of the funding is a large portion is for personnel, but then also funding is for having the events in the community. Now I can't remember if they were planning on opening a second location. I know they have regular drop-in hours. So they are pretty available to the community. And this is more of a new, from my perspective, this is like something new that we haven't really, had in the community. And it's something that I know many people appreciate and want, but didn't know how to start. So I really appreciate having this this group intervene after the effects of gun violence to help the community deal with the trauma, the long-lasting trauma that the families and young adults will be affected by from shootings. And the staff seem from the report, the staff have their credentials are having bachelor degrees. One of the things was that they get their funding not just from the mental health board, but from various other sources, from various contributions, and the city of Champaign gave them a grant for $20,000. And so it seems like they are diversified in their support, which is good. I mean, from my perspective, it seems like it's a pretty, well-run organization that, hopefully is going to be effective. It's very evidence-based from the report. The only thing is it's going to be hard to measure outcomes. The outcomes will probably be long-term outcomes, not short-term outcomes. But it seems from the description that they're doing everything, scientifically, and so I only have the best hopes that they will make a very positive effect in the long term. So I think it's a great organization, but happy to hear other people's thoughts.
I mean, and I think when we think about something like this, it's not a short-term thing, because a spike in gun violence over the last couple of years here has been building up. And one of the things that we're looking at is that there has been trauma within the larger community, and they're trying to address this. And you don't just address it when there is trauma, you address it consistently. And that's what would eventually decrease the amount of trauma within the community, and where gun violence hopefully will decrease because of that. Is there a representative who could add to this?
Yes, there is someone here from the program.
So technology, right? So I just want to say, we're committed to addressing trauma, preventing trauma, reducing the signs and symptoms of trauma. The shift slightly, so we have received funding before, but we were really focused on care coordination and case management, and we're still doing that, but we realized that we wanted to intensify sort of the follow-up care for people, because what we found through sort of needs assessment was that there wasn't a lot of, there's therapy, but there's not trauma-centered resiliency building therapeutic approaches that really support people on more of a peer-based, more of a natural support, right? So if you think about a community resiliency building model, we just weren't aware of those resources that existed that were resiliency-based sort of before you needed to get people into therapy. And so we're trying to really sort of serve that bridge, same population, but adding another level to help promote more healing and recovery.
Susan also has a question.
Yeah, I wanted to say that, I'm really impressed by the movement to have psychoeducational groups for the mothers and caregivers, and the 8-week groups for adults impacted by gun violence, and your workshops for teens and young children. And I'm assuming that must be replacing in part what had been the neighborhood champions.
Yes, and so, well, it's sort of building upon that, sort of taking those same skill sets, but also having a chance to have them have more longer term relationships, more supportive relationships with families.
So you've learned from the process of the neighborhood champions, it wasn't long enough term, and you've moved on to a more intensive model. Would that be a fair summary?
Yes, very much so.
Okay, that's what I was just trying to figure out. Thank you.
Thank you.
Thank you. Any other questions or comments? Thank you.
So Joe, your next one is first followers.
Okay, I think I'm the first review on this. This is a program, First Steps Community Reentry House, presented by but there was someone else talking. It's just a dog barking. By first followers. They're asking us for $60,000. This is a new program, and what they intend to do with this program is to provide stable living conditions, enhance opportunities to find employment, be able to connect those re-entering into the community to social services, also help them build some more connections throughout the community, help them seek some financial security. And if you know about people trying to re-enter the community, it's an awful lot like the Cunningham program we just talked about. Is one of the first things to secure re-entry is first housing and then employment. And First Followers has been pretty innovative in how they have begun to address these issues. So we should feel pretty proud of ourselves for funding these guys and coming in with a program we've kind of helped them, given them the time and the space to kind of put it together and address issues that have heretofore not been attended to. This new housing, and they're working with the housing authority. You have to realize how incredible it is to have that facility for these young men and women coming back to the community, because it's one of our local communities that makes it possible for landlords not to rent to returnees. So for them to have their own spaces is really unique, and they provide an awful lot of services. In addition to housing, this will also provide opportunity for these folks to get employment. If you look at the expenses for what they want us to pay for, it looks like the expenses that you would have in your own home: furnishing, clothing, food, rent. So it sounds like the stuff that all of us have to deal with, but imagine if you're just returning from incarceration, you wouldn't have those things accessible to you. So that's what they would like to do. In addition to their counselors and peer counselors that they will provide through this service. I have only one question, and then I see that there are two representatives, and so I have a comment for them. The question is from Mark Driscoll about the budget, where it looks like there was maybe the revenue exceeded the expenses, and I'm imagining that you folks have already dealt with that with First Followers. Mark, can you speak to that?
No, we haven't had any conversation with them about their budget. Once we got to the contracting phase, that's when we would address that.
Okay.
There are significant issues with how the budget was put together and a considerable lack of other information. There's some inconsistencies throughout the application.
Yeah, I'm guessing that since this is such a brand new program, it's very difficult to make some guesses about what it's going to be. I have one comment for either of the two representatives. It struck me that if we talk about the impact of this program, one of the impacts I think is that doesn't get addressed well around this issue of returning, not this program, but in general, is that if we maintain people in the community and they don't have to be returned to incarceration, which is one of the goals, is that we are also reducing the amount of money that it's cost to house a person in incarceration. So that becomes a very important gain that we're making. And I'm wondering if either of you guys think that there's a way to track that every time somebody doesn't return to prison, that we've saved the state a certain amount of money, and then they're also employed, and so they're paying taxes. So it's a big boost to the taxpayers to not have these young men and women return to incarceration. Do you have any thoughts about how if you'd want to do that, and how you would do that, and what do you think it might end up being for us?
Sure.
Maybe
Sure.
Joe, you can speak first. I don't know.
Sure, it's James here, but I think I think that's a really interesting parameter, and of course we know that it costs somewhere in the neighborhood of $36,000 to keep somebody in prison for a year. So if you look at that cost compared to the cost of operating our house, our house really does look like a bargain if once we get up to having 4 people in the house, and we also feel that this is a model that can go to scale, so we can get some increasing returns on having more people with the staff and the experience that we're building up with this. But I think that's an important point. I don't know, Marla, if you want to add anything.
No, I don't have anything else to add besides the fact that one of the things that we are doing is it's a model that we've thought about for 2 or 3 years, and then we've finally built up enough internal capacity to kind of roll this out. And so from there, it's a model that we want to actually build up and out with the relationship that we have with the housing authority and the folks over there, because they have a lot of property here in Champaign County that is vacant. So it's a startup, but at the same time, I think we've been in business for 4 or 5 years, and we've built the internal capacity to be able to provide the services and case management that goes along with running a house like this.
Thanks. Joe, I don't know if you
Julian has a question.
Well, Joe is the second. Did you have something to add, Joe?
Okay.
I don't have anything to add. I mean, I think the whole idea of, I think it's a great idea because it's pay me now, pay me later. And it's worth it. It's worth every penny of it.
Okay, Julian has his hand up and hand raised.
Go ahead,
So.
Thank you. I guess I want to ask about the staff is suggesting that it may be advisable to require documentation of prospective residents' mental illness and/or substance use disorder diagnosis as a part of eligibility. And I guess I'm wondering what the applicants think about that.
Well, I think first of all, I mean, our original proposal for seeking funding from the Mental Health Board was based on the fact that there's a post-traumatic stress associated with incarceration. So that really kind of goes with the territory of the particular constituency that we're dealing with. Now, of course, I mean, when we do intake and when we, as we build a relationship with people, we're going to look at mental health issues, and we're going to try to provide whatever support we can, and certainly connect them to other services that are available in the community if they need a more professional kind of level of mental health support than we're able to provide. But I mean, since most of us are people who have come home from prison, we know that there's a trauma and a sort of a whole set of psychological problems that come with that transition. And our intention is through peer mentoring that we can at least address some of those, or be able to identify the ones that need greater support than we can provide.
So if I can add on to that, one point I would like to make is oftentimes part of a person's parole mandate is that they have to get a mental health assessment. Up to 70, 80% of the folks that come home have to have that as part of their parole.
Okay.
I was the second reader on this.
Okay. It's okay.
By the way.
Go ahead. I read it too.
So I just want to say that was Julian's question was a question I was going to ask. I would like to have seen some more detail on the cultural competency, cultural literacy program, at least as we received it. There wasn't much detail. And of course, you are dealing with a population that is, marginalized and stigmatized to start with, but there are a lot of other pieces to that I hope that we'd see more elaboration on at some point. Thanks.
Very late. I thought Joe was.
It's okay, Tom.
Oh, it's okay.
I just have one more question I wanted to ask.
Go ahead.
Can either you, is this a program where people get experience in construction experience because they help get the house prepared for living, or is that a different program?
James or Marlon, I think that question is directed to you.
Yeah, go ahead, Marlon. Okay, well, so the construction piece is actually part of our GOMED program, which is focused on the age group 18 to 24. So that's where we devote most of that construction and instruction and practical experience. Okay. But I think also depending on the individual, I mean, there might be a way for them to slot into that as well. Given if they have that skill set, they might be able to help instruct the younger guys. They might also be able to help do some of the work as part of their own transition into employment. But it's not really a fixed part of the program.
Just a quick answer. I'm also a counselor at Parkland. I mean, the SWIFT program is a program that would probably be something that you guys could look into as a way to do some short-term training for some career programs in construction, design, management, things like that.
Yes, we've had some people do some of those short courses, but we want to make much more use of it.
Joe, your time is up on this application, unless you have any more questions.
No more questions here. You have any more questions, anybody? It's 7:42. So what, do we keep going?
Keep going.
I would like to, I need to point out something that you have 3 items to discuss and vote on tonight. And those have to be done in a board meeting, but the discussion of applications could be resumed next week at the study session. So when you're feeling like you want to wind it down, remember that we have those 3 things to talk about still.
So
Julian has his hand up, Joe.
Go ahead, Julian.
Sorry. Well, I guess I don't think we're going to get through the rest of this list tonight at the rate that we're going and do what Lynn wants to do. So my suggestion would be we decide how many more of these we're going to do, if any, and set a goal and then move on, because I can't do it all night. So at least that's my vote.
Okay. Anybody have any added comments to that? And anybody willing to make a motion about it if need be? Any comments? Jane, I can't hear you.
Jane, you're on mute.
Thought I hit it, sorry. I make a motion that we suspend evaluation of programs at this time so we can take care of other board business, and we will resume next week during the study session.
Second.
So Joe, you have to carry out the motion.
Oh yeah, my bad. So Jane put forth a motion saying let's table it till next week.
And then Julian has a question.
Go ahead, Julian.
No, I was just going to second it.
Okay, so he can second it, Joe, and then you carry it through.
Okay, so it's a voice vote. So what, the voice vote? All in favor?
Yep.
Aye.
Aye.
Okay. Let's table till next week, and let's move to all the 3 items to vote on for this meeting.
So the first item is the annual report. And I don't, if you want to make changes in the annual report, we can absolutely do that. The reason I hoped that we would be able to talk about it tonight is that there's sort of a, by statute, there's a timer on it. And because we had to cancel the March meeting, we're already a little bit late with it. So if you want changes to it, then we'll be considering it again in May. So anyway, that's the first action item for you, and that'll be a voice vote. So I'm gonna mute myself and you carry on.
Julian has his hand raised.
I do?
Go ahead, Julian.
Oh, sorry. I just forgot to bring it down.
Oh, okay.
So is there a motion for this?
I move to approve the Champaign County Mental Health Board fiscal year 2019 annual report.
I will second.
I second it.
Okay. Voice vote. All in favor?
Aye.
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 Staff reports? No, I just jumped ahead. Agency information.
This is from any organizations or anyone that has any information they would like to share at this time. If you do have something you'd like to share at this time, you can go in the chat box or the participants part and raise your hand, and then you can speak. Joe, it looks like no one has anything that they have asked to report at this time. Oh, hold on. Sarah Blagoyan from Muhammad Area Youth Club has her hand raised.
Okay.
Hi, guys. I meant to do this in the public comment earlier. I just wanted to say a big thank you to Lynn and Mark and Chris and Stephanie. The information they've been sharing related to COVID and resources in the last 5 weeks or so has just been really amazing and helpful. So wanted to just give a thank you for that.
Thank you. Thank you, Sarah.
Okay, there are no other hands
So the
raised.
next is just schedules and allocation timeline. And I know that there's not an official extension of the emergency declaration by Governor Pritzker, but it's very likely that your meeting in May will also be a virtual. You actually have two meetings. One is a study session again, and one is a regular meeting, just to give you enough time to discuss our thoughts about funding. And then we might have some other action items in May. So the schedules are not changed in any other way from the last time you saw the schedules, except that I maybe added a question mark because I'm thinking this will be a remote set of meetings too.
Okay. We'll deal with it. So is there a motion for that or just information?
If you have concerns about the schedule, we can, if people have concerns right now, we could hear that, or we could work on it offline. Sometimes, you know, it'll be just one or two people who can't come to a meeting, so we don't reschedule it. But if it's really bad, we can change the schedule. We just need to provide the public as much notice as we can.
Yeah.
Okay.
Thank you.
Do you want me to do DDB information? We had a DD member on the call a while ago. We also have the associate director for DD is on the call, but she might not be expecting me to ask her to tell you. I'll just tell you that this morning the DDB had our very first all Zoom meeting, and it went very smoothly. And I felt, you know, I felt sort of weird for having been so panicked and anxious about it because it was just smooth, and this one's been very smooth. They did roughly the same business. They don't have a formal annual report requirement, so they didn't do that. They see some of the same information in the fall. But they went through program summaries, and they they had a little update about their mini grant project, which we did last fall. And then, you know, it's been very slow making purchases because of problems with the very practical problems having to do with credit cards and other county departments. And so Kim Bowdry, who was on, she's still there, has done a really great job of executing the direction of the DD board for this mini grant project. And it's amazing that the things these people wanted just became a million times more relevant to their lives, because it's a lot of stuff like iPads and computers and exercise equipment, like things for people who are stuck at home. So it has felt really rewarding in the last few weeks to have done that. So anyway, that's basically the update with the DDB. Okay.
Great, thank you. So approval of a meeting minutes from February. Any corrections or discrepancies?
I move that we accept the minutes from February.
Second.
All in favor?
Aye.
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 Board to board reports?
Hey, Joe, guess what?
What?
I forgot to give a shout out to Chris Wilson, who's also on this call, who he and Kim have been doing this mini grant stuff together, and it was pretty nightmarish for a while, but the two of them developed some systems to make it smooth and to get people what they wanted. I apologize for forgetting about that part. That was very important. So sorry.
Thank you. Any board to board reports? I mean, we've all been, probably not.
Well, I did listen in to the electronic meeting of the Rosecrans Community Board.
Okay.
And so they're continuing to work and figuring out what to do. And so far, they're not reporting too much disruption, but I imagine they're anticipating some that's going to happen soon. Because, so we'll see. Anyway, I don't really have anything substantive to say, except that they have a new board chair, I believe. But I don't know that that necessarily concerns us. It was just, it's good to listen every once in a while to what the boards are discussing. And they raised, somebody at that meeting actually raised an interesting question is, well, what's the point of a community board? And so I think that might be something that they take up and discuss. And I think that's just a good question for everybody to raise periodically. So yeah, that's my report.
Thank you. Thank you, Julian. Anyone else? Okay. I mean, expenditure list.
I move to approve the expenditures as listed.
Okay.
All in favor?
Aye.
Right. Any board announcements?
I think we should congratulate ourselves on the Zoom meeting.
Here, here.
And making it through almost half of the proposals.
Yes.
Yeah. Good job, Joe.
Oh, I was dreading today. Well,
Tom has his hand raised.
Yeah, go ahead, Tom.
Okay, before we go, I just wanted to say to Lynn, thanks for keeping us informed about this corona pandemic situation, what's going on locally and around the state and nationally. I don't know how you're managing to keep up doing your regular work as well as getting us informed about all the other information that you seem to be handling and getting out to us. But it sure makes one feel like they have some sense of what might be going on with this stuff. So thank you very much for the job that you guys have been doing.
Yes.
I'm just echoing what others have already said and didn't have a chance to do it before. So thank you very much for that.
Yes, thanks, Lynn.
And
Thanks.
Stephanie has her hand raised.
Go ahead, Stephanie.
I just want to remind everyone to have their packets with them at next week's meeting, because this information isn't going to be mailed out again.
Okay. Will do.
I hope that's okay with y'all. We can certainly provide the link to the board packet again. The link is on the county website, so it's very easy for me to get. But I like having paper and pen, so thank you all.
Thank you. Anybody move to adjourn?
I make a motion, we adjourn.
I will second that.
All in favor?
Aye.
Aye.
Aye. Thank you very much, and have a wonderful, safe week. See you in 166 hours or so. Take care.
Okay.
Bye, y'all.
Bye.
Bye.